If you can hear me, my microphone is on. I'm James Dunn, newly appointed as the Executive Director of the Commission on Aging and Disability. I want to thank, of course, all of our guests for being here today. Welcome to those streaming online. Thank you for all that you do to raise awareness for these issues that we are working on. I also want to thank Senator Briggs and Representative Carr and the other legislative members who enacted legislation to make this task force possible as we study this vulnerable population of the elderly and financial exploitation and abuse. And I want to thank, next to me, Commissioner Carter Lawrence of the Department of Commerce for being here today as well, who has done a great deal on this issue through fraud with consumer insurance and other issues. Commissioner Gonzalez of Financial Institutions, and Director Roush, who has been a good friend to me and has helped shed light on these issues. This is really a continuation. We have had one of these task forces before. Legislatively speaking, the Commission on Aging is required to produce a report to the legislature, which we will do following this meeting. We have several people presenting today. We have about 15 minutes per speaker, so we'll keep that timed. If you run out of time, we'll ask questions at that point of time. So I would ask that the committee reserve their questions until the presentation is complete. And then once we get through all of our presentations, we will have further discussion. One of the first items of business that we will have to do, and because the agenda is already set, we'll just continue to run the meeting as is. But one of the things that we must deal with is that we must elect a chair and a vice chair. Are there any nominations for chair?
I'd like to nominate General Z.
General Z. Are there any seconds?
I'll second.
Second. All in favor say aye. Aye. All opposed say nay. Ayes have it. Are there any nominations for vice chair? All right. I'll nominate then Commissioner Gonzalez. How about that? Any seconds?
Second.
All in favor say aye.
Aye.
All opposed say nay. Ayes have it. All right, we will get started. Ms. Larisha, can you please do the roll call for us?
Yes. Commissioner Carter Lawrence.
Here.
Commissioner Greg Gonzalez.
Here.
Director David Roush.
Here.
Sally Pitts.
Here.
Stacy Langford.
Here.
Renee Bouchalon.
Here.
Kim Bohannon. Lisa. sorry. Lisa Z. Here. Jesse Samples. We have a quorum.
Thank you, Larisha. Well, we will get started. Director Rouse, we have put in here on this agenda 1-800 hotline. I don't know if that's sufficiently described, but Director Rouse has been working on this issue of tying in the TBI and law enforcement and how the banking industry may follow up with them. And so we'll let him get started. And Director, if you want to speak from here, feel free to do so. Please proceed.
Thank you. I appreciate it. James, thank you for your leadership on this task force and for your new role. We're excited to have you in this space. So over the past few months, we've been meeting with the TBI and a number of our partners, Greg and a number of others, discussing how we can better pay attention to this issue of financial exploitation, and to determine if there's anything that we can do, the TBI can do in this space to assist. And we sat through a presentation from a former investigator in Oak Ridge who showed all of his the work that she was able to accomplish in Anderson County, which was pretty impressive. And then we started having some open discussion with our partners in the financial industry on what the challenges are. And so one of the things that came out of that discussion was a really the financial institutions said, it'd be nice if we had basically a 911 for these issues, right? Because the challenge is when they call the traditional 911, the response varies depending on where you are. Some areas are robust and understand it and handle it appropriately, but most don't. Most of them will either tell them that it's a civil matter, and they don't even take a report. And some will take a report and then pass it on, hoping that maybe the folks at APS will handle it. And quite frankly, they have limitations because if the money isn't connected to some government fund, then there's not a nexus. And so through these conversations that we had, we started to have a conversation with our team. And when we heard this request for a 911, we thought, we house a number of hotlines for the state of Tennessee. We have we have the Amber Alert system. We have now the Silver Alert system. We have a number of numbers that folks can call to get assistance, and that we connect. One of the things I think TBI does best is we connect resources, and so our team said, well, what if we set up a hotline for this, where the financial institutions can have a number to call in, make the report, and get advice from our team on what the next steps should be, and then the connectivity, right, of connecting law enforcement to the issue in a way that is seamless and is consistent. And so that became where we're at now. So on the slide there, you see financial exploitation is covered under 3915-502 in our statutes. And so, obviously, if someone financially exploits an elderly adult, 70 years or older, vulnerable adult, it's punished at theft, but one classification higher, and that went into effect in 2017. And thanks to our District Attorney General's Conference, this is the law that they helped us get in the books. And so they've been big on this issue of getting it codified. And so it shows the fine and all that. And then there are three types of exploitation. There's control over property, which is deception, breach of fiduciary duty, and then exercising control of property by a caregiver. What we know is the vast majority of these cases are conducted by or exploited by a family, which makes it even more difficult because it's less likely to get reported. What happens at financial institutions is when they show up there, they have a feel that there's something not right, but they're not always aware of what they can do. And they're looking for guidance, right? And I think more than anything, they're looking for someone to say, it's okay to pause, right? We have a law that says you can pause. You can go to the next slide, I think. So some of the facts from this, from the commission, and the Comptroller's report, there are 76 million baby boomers in the USA. There are 5 million elder abuse victims reported each year. Now, I think it's important to look at this is the combined total of child abuse and domestic violence together. So one of the conversations we've been having very seriously is if we were looking at our elder justice system like we look at our child abuse system, right? We would be embarrassed at how we are addressing these issues. We do a really good job on the child abuse side. We've got to get to that same level on this side of it. We don't have the focus we should have on addressing these issues. And it's becoming more and more of an issue because more and more of us are entering this age. The baby boomers, we're just about, all of us are just about there now. And it's absolutely something we need to turn our focus to as a state specifically. So the annual loss says $36.5 billion. I would tell you that's an undercount. I think annually it's going to be much, much higher than that. And we know that because of the cases we're seeing here in Tennessee that are in the millions of dollars. And so, I mean, if they're here that big, then nationally they've got to be even larger. We know that 1 in 10 elders are victims of offender abuse, but only 1 in 14 are reported. 1 in 10 turn to Medicaid as a result of the money being stolen. So here's somebody who is financially set and can handle things themselves, and then they get this financial abuse happens, and now they become a ward of the state, and that costs the state even more money. So the financial cost exponentially goes up as a result of this type of criminal activity. We know that they hold the majority of wealth in the U.S., which is why they're the victims. That's why they're being victimized. Everybody knows that they hold the majority of wealth in the U.S. And again, back on the comment about the child system, we're 40 years behind in the way we report and handle these crimes. Victims continue to be victimized. They have a third of a chance of dying sooner when they become a victim. Another astonishing statistic. And then, again, most are ashamed to tell because it's family. And it is the fastest growing crime. And it says in the next 5 years, I would tell you, we're already there. We don't have to wait 5 years. We are there. We continue to see the high number of victimization in this arena. So our plan, after having these conversations with our partners, we want to create this financial institution 911, if you will, for suspected financial exploitation, a TBI hotline to field the calls and provide advice and connect local law enforcement. We want to educate all the financial institutions as well as law enforcement on the pause law 45-1203. That's our goal. That's what we are looking to do. The next steps that we have started working on is working with our financial institution partners. We've got an upcoming meeting to have a conversation with them because we need some data. We need to know what the scope and scale of this is, so we know what we need to stand up, how many people we might need. We're hoping our goal is to do it without cost, without. The governor always likes when I can step to him and say I have something we can do without costing the state any money, additional money. Our hope is we can do that, but it's going to depend on scope and scale. And we think we'll be okay. We just don't know yet until we have the data. So that's next steps that we're working on is to get the data. We've had some great conversations with APS, with our local law enforcement partners. They're excited about the opportunity to really make an impact in this arena. And so I think we're gonna start seeing some great progress. Our goal is to get this as quickly as possible. And frankly, I think Tennessee will lead the way if we can get this accomplished in terms of financial exploitation. That's the conversations we've been hearing on the national level as well, is they're looking at us to see what we're able to accomplish here in order to model this. And so that's the briefing. If anyone has questions, happy to take those whenever you see fit.
Thank you, Director. If there are any questions, if you could just let me know. Oh, by the way, if we might mention it, Senator Powers is here on the far left end, who's doing a lot for, I'm sorry? Oh, excuse me, Senator Rose. I apologize, Senator Rose. Forgive me on that. But Senator Rose is here and has done a lot with elder abuse, working with the DAs and other folks. I know presented some legislation last year and is looking to do some more this year. So we appreciate you being here, Senator. Before we get into questions, is there anything that you would like to add for the audience?
Not for the audience, for you. You need
Yes,
to call Senator Powers and apologize. But other than that, I'll wait. I'm sure I'll have plenty of questions, but maybe they'll be answered as we walk through this. So thank you very much.
Thank you, Senator Rose. Are there any further questions for Director Roush of the committee? Commissioner Gonzalez?
I don't really have a question, but I just wanted to commend Director Roush and the TBI for taking this on. This is a big, big effort. And he's exactly right. We could be a leader throughout the country if they're able to do this. So everybody's going to have to, I know, add support to what they're doing. And we've had good conversations with financial institutions, and I know that they're looking forward, they're excited about what you're looking to stand up there. And so we just wanted to commend and to add our support to this effort.
Thank you, Commissioner Gonzalez. Commissioner Lawrence?
Yeah, thank you. So, question, when you were comparing or contrasting, rather, against DCS, and you mentioned the timeline of 40 years ago, I'm curious, did you mean that from a, like that's where, if you wind back the clock, that's where DCS was 40 years ago, or where the law was, technology, just a little more information about that, if you don't mind. Thanks.
Yeah, absolutely. So there are, yes, I think is the answer. So the answer is our laws are not at the level, our services, more than anything, our services aren't where DCS was, quite frankly, and is. But even 40 years ago, I don't think our services are near where DCS even was 40 years ago, quite frankly. And so I think that's a huge issue. I think it's about resources. I think that's a big piece, but it's also, frankly, it's about awareness and action. I think those are the key pieces here that are missing right now. I don't think, and I don't know the reason. I can't psychologically give you that. I think we just don't, unfortunately, view the issues that are happening to our elders the same as we view them to our children, and that's a problem. One of the things, and I tell folks this all the time, those of us who get into this business in law enforcement, there are two populations we really focus on in terms of our efforts, and that is children and seniors and the vulnerable. That's because everybody else in the middle, they can take care of themselves for the most part, right? So where we really want to put our focus and effort is how we protect those two ends of the spectrum. Is how do we keep them safe? And I think we've done a really good job on the front end with our children. Now we're not perfect, but I think we do a really good job. I think we have done much less on the other end, and maybe it's I don't know. I'm not even sure I can surmise why. I think it's just that we haven't put the attention to it, and I think when we start speaking to it and start comparing those systems, that's where I think we'll start to really make a difference. If we can start looking at the services we provide, so simple things. And when you talk about DC, on the DCS side, and compare DCS to APS, there's no comparison. I mean, there's personnel-wise, the financial commitment, there's no comparison. And so I think that's one area we've got to get serious in. And so the resources need to be addressed in that manner. And then again, when we start talking about, we have foster care for children. We don't have a similar system for seniors who can't take care of themselves, right? We rely on quite frankly a really loose system. Where someone will be appointed as a caregiver or appointed as a conservator or in charge of the financial affairs, and really it's a transactional relationship, and that's not what's needed. And so I think that's where we can start getting better. Then I'll get off the soapbox.
Thank you.
Are there any further questions? Yes, ma'am.
I think this is a great idea. This is a really great start to getting the financial institutions involved and having the confidence that they can call someone. I think that's fantastic. Of course, me and what I do every day, my next question is, okay, then what? How do we get from the hotline to the bank immediately? How do we do that? Because we don't want to lose that case. Most of these cases that come to my office as the DA, it's too late. The money's gone, and I'm never going to get the money back. So that is the one thing. Have we put any thought process into that?
Yeah, so that's I think that's the wonder of this process is the phone call will give that advice immediately to the bank, and then what they'll be able to do is enact the pause, right, so that the money isn't taken, and then there's an opportunity for an investigation to determine is it legitimate or not, because there are going to be high number dollar transactions that are legitimate. We know that. But if there is, when they go through this list of questions of, to determine the suspicious nature of the transaction, then I think then the bank gets the confidence to say, okay, we'll pause. And they have, I think, here's the other part to this I think that helps, and that is because of not anything I've done, but because of the great reputation of the organization I get to lead, right, is when they tell a financial institution you can pause, that gives them the confidence to get it done, right? And that money gets protected at that point. So, and then the next critical part is that, General, is that we connect law enforcement to the investigation and that they take it serious and they know what to do. And I think that's the next critical part. And our partners are willing to have these opportunities to do that. And so I think that's, again, you're right. We've got to keep it from happening in the first place. Because once it's happened, I mean, again, the money's gone and the system's not helping. So we got to get it on the front end, stop it, and it's the core reason law enforcement exists: prevention, right? And it's not the sexiest thing in the world, but it sure is going to be great for those who get protected.
Thank you, Director. Are there any further questions, comments of the guest? All right. Well, Director, just to echo Commissioner Gonzalez's point, thank you for all that you're doing on this issue. You've been very diligent on this. The bankers, I think, also have been very helpful as a partner to all of this. I think it's important to take into account that these folks who work on financial matters, that is a matter of their business. To the extent we can do things that do not unnecessarily infringe with their business activities, but allow law enforcement to do the great work that they do, I'm all in favor of supporting that. It sounds like we're waiting on some data before any determination is made as to whether or not there are resources for the hotline and other things that may be needed. So look forward to learning more about that as you team up with the financial institutions. We will move on now to our next speaker, Mr. Blancado, who is renowned nationally for issues of elder abuse. He will be streaming into us from Washington, D.C. He is a consultant and has been involved in this arena for many a year. Mason, is he ready? Mr. Blancado?
Yes, I'm ready. Can you hear me?
We can hear you, sir.
Okay, thank you, Mr. Chairman and members of the task force. And I want to thank the person moving the slides. So can we move to the first slide? And let me start by saying I appreciate the invitation to present at your meeting today. I want to thank my friend Aaron Bradley for making the initial outreach. Also want to thank Mason for his great help in putting this together. Your work has been very important. I had a chance to look at your interim report, and your focus on financial exploitation is very important. I will spend some time focusing on what's going on here in Washington on the elder justice space, in particular with a focus on financial abuse and exploitation. Next slide. So our coalition is a bipartisan 3,000 member coalition. I serve as its national coordinator, and we are the national voice working to promote elder justice by preventing elder abuse. Work has included leading the advocacy effort that led to the Elder Justice Act of 2010 and securing the nearly $400 million provided to the act between December 2020 and March 2021. We're very proud to have a number of national, state, and local groups, including at least 3 from Tennessee, and we appreciate their support. Next slide. So let's talk about the state of the problem. And there's some recent data on this. In 2020, according to the Federal Trade Commission and the Senate Special Committee on Aging, older adults lost at least $602 million to fraud, scams, and financial exploitation schemes, with $100 million lost to COVID-19 related fraud alone. Most of the COVID-19 scams are those involving contact tracing, virus, antibody test kits, vaccines, and other miracle cures. And then loneliness and isolation necessitated by the coronavirus has led to sharp increases in online romance fraud. Look at the number of complaints that increased between 2015 and 2019 on that topic alone. Next slide. Then we have the issue of scams and cybercrime. And again, according to the Senate Aging Committee report, the top 5 scams reported to their fraud hotline were government impersonation scams, sweepstakes scams, illegal robocalls and unsolicited phone calls, computer scams, probably the most insidious of them all, the grandparent scams. Federal Trade Commission estimated that in 2020, romance scams alone resulted in the loss of over $139 million to older adults. And reports indicate that frauds that reached older adults via social media have more than doubled from 2019 to 2020. And so far in 2021, these reports have already exceeded the 2020 totals. And then finally, according to the FBI Internet Crime Complaint Center, persons over 60 make up the majority of U.S. cybercrime victims in 2019 and accounted for the most losses, an average of nearly $10,000 loss per victim. So let's go to the next slide and see what's going on up here in terms of the response from the federal government. As I noted earlier, Congress on a bipartisan basis has responded by providing nearly $400 million in new money for the Elder Justice Act over just 4 months. And prior to that, we had only secured $70 million for the same act over 10 years. 90% of these funds are going to adult protective services, the rest to the long-term care ombudsman program. The first portion of money, the money that was passed in December, left Washington quickly. All states were invited to apply, and all states did apply for the APS funding. And I recommend you look closely at the Tennessee plan. Next slide. What the Administration for Community Living, which is responsible for these funding, provided guidelines for how these funds should be used. And they focused especially on costs associated with establishing new and improving existing processes for responding to alleged scams and frauds, especially related to COVID-19 vaccine and cure scams. And I had an opportunity to glance at this Tennessee plan, and I'm particularly positive in your call for a public awareness campaign partnering with the Tennessee Attorney General and others to deal with improving your response to scams that are related to COVID-19. You can also use these funds for training costs, funds for travel related to required by COVID-19, improving data collection, which we can never do enough of, frankly, and doing more community outreach. And the second installment of funding, the one that was passed in March, there's guidance expected very soon on that. Next slide. Now, also in Washington right now, I mean, literally right now, there is a critical provision in the House version of the Build Back Better Act, which you've been hearing about. It's not the infrastructure bill, it's the other bill, the larger bill of the two. The bill that's awaiting a full vote in the House would provide $4 billion in new funding for elder justice to support the existing work of adult protective services and ombudsman, new incentives to increase and improve nursing home staffing, medical legal partnerships and legal hotlines would be established in a wider range than they are now, and then funding for area agencies on aging and other community-based organizations to combat social isolation. Next slide. The Senate version of this bill has not yet been finalized, as you know. However, the chairman of the Finance Committee, Senator Wyden, has introduced a bill in August calling for that $4 billion, which to me is a good sign. Now, as you probably know from following it, it's unclear what's going to actually get enacted in the larger Build Back Better Act. The bill is shrinking by the day, but our coalition is going to continue to work and hold on to as much funding as possible. Next slide. Let me touch on a couple other bills that are up here in Washington. H.R. 1215, the Fraud and Scam Reduction Act, which passed the House, and the Senate is expected to pass it very soon. It's a blending of some other bills, the Stop Senior Scam Act and the Senior Fraud Prevention Act, both of which have been introduced in the Senate. It would establish a senior scam prevention advisory group to report to the Federal Trade Commission and produce and gather informational materials for retailers, financial services, and wire transfer companies, and would establish an office for the prevention of fraud targeting seniors in the Federal Trade Commission. Next slide. A couple other bills of note: the Senior Financial Empowerment Act of 2021, bill to prevent mail, telemarketing, and internet fraud and to educate older adults and their families on fraud issues. And the Financial Exploitation Prevention Act of 2021, another bipartisan bill, which this issue is, to postpone the date of payment or satisfaction upon redemption of securities in the case of financial exploitation. Next slide. So in closing, let me just point out that I want to first of all commend you. Oh, I'm one ahead of myself. The Senate Aging Committee just held a hearing on conservatorships. Now, you know the story about Britney Spears. That was the focus of that hearing. And we also have a program called the Senior Safe Act, which eliminates banks' liability from reporting elder abuse if the reporters are properly trained. This is a law that went into effect in 2018 and is now being implemented very effectively by financial institutions. Now the next slide for closing. So I want to commend the work of your task force. I hope you communicate with your congressional delegation, especially those who have key committee assignments, like Senator Hagerty, who's on the Appropriations Committee, which provides money, Senator Blackburn, who's on the Judiciary Committee that deals with this issue of elder abuse as a crime issue, which it is, and same with Congressman Fleischman, Congressman Owen. And I urge your continued response to combating financial exploitation of older adults. And when you communicate with your members and your delegation, remind them this has always been a bipartisan issue in Washington. And certainly the time to act is now. And the last slide we can keep up, it's the resource slide where you can get additional information on what I've talked about so far. So thank you very much for the chance to join you this morning.
Thank you, sir. Are there any questions from the committee of Mr. Blancato or comments? Commissioner Gonzalez? Oh, excuse me, Senator?
Senator Rose or Powers, either one you want to call on. I'll respond either. Mr. Blancato, thank you for being with us today. My question, you mentioned we need to look, or maybe you said you should look at the Tennessee plan. Would you expand on that, or are you seeing we did not ask for enough? We did. What do we do differently than what we've already done?
Oh, I heard part of the question, but the Tennessee plan associated with the money that was passed, every state, the money is distributed on a formula basis. And so you're only entitled to get a certain amount of money, but every state in the United States did apply for this Adult Protective Service money. And from what I've seen of the Tennessee plan, it has a proper focus on the question of financial exploitation as it relates to the COVID-19 scams. Now, there's a second portion of money that will become available very soon, and the federal government will provide guidance again to the states on how they could use this money. My belief, from what I've heard so far, is that they're going to continue to keep a focus on addressing those elements of elder abuse that are tied directly to COVID-19. So from what I'm gathering, the Tennessee plan is a good plan. It started off well. It's got some collaboration in it between different agencies, which should be together on this topic. But speak to your Adult Protective Service director, and they can probably give you more insights into exactly what's in that plan.
Just one comment. If you probably don't have any influence on this, but any money that you can send to the state instead of letting the federal government handle these issues, in my opinion, is going to be much better spent. So pass that along, and I will to Hagerty and Senator Blackburn as well. Thank you.
Senator, I couldn't agree with you more, and I will tell you from my work in this field, the federal government understands that the solution to elder abuse prevention is at the state and local level. They know that that's where the activity is. It is now more about the federal government providing resources, which have been long overdue, to states and localities to do that work. This is not going to be a federalized issue. This is seen as something that the states and local government should focus on, but they need help with resources. So hopefully that's the way it's going to work out.
Thank you.
Are there any further questions? Commissioner Lawrence?
Yeah, thank you. And Bob, I apologize. I kind of lost track when you were talking about the current status within the two bills. I tend to think of them as there's the really expensive one and then the extremely expensive one.
Right.
And
Right.
what I gathered was that the $400 million was in, or I'm sorry, $400 billion was in the extremely expensive bill, which my watching of the punditry seems like that one is unlikely to succeed. So I guess I'm curious what your prognostications are as to
Well,
the future of the funding.
We spend every day up here prognosticating on this, and that bill's going to play itself out. It's safe to say that it's not going to be a $3.5 trillion bill. It's also safe to say it's not going to be a $1.5 trillion bill, which is considered the lower number between the two. President has talked about something in the vicinity of 2.3 billion to 2.3 to 2.5 trillion. I'm sorry. And it's anybody's guess. The question is going to be, when you shrink this bill, do you do a haircut to everybody, or do you prioritize between programs? We're going to argue from the Elder Justice Coalition perspective that the $4 billion intended for elder justice activities, elder abuse prevention activities, is in fact a good investment of money, because if you can prevent elder abuse, you're doing your community good, you're saving money on healthcare costs and so on. But there's no question this bill is shrinking, and it will continue to shrink. And all I can do is just sort of stay tuned till Halloween, and there's probably going to be a lot of activity on Halloween beyond trick-or-treating.
Thank you, sir. Are there any further questions or comments for Mr. Blancato? Be happy to reach out to the delegation. I think maybe that's a field trip that we all need to take. If we figure out how APS, law enforcement, others might work together at the state level, we have a lot of different moving parts. And sometimes I think it's really just a matter of figuring out how all that should be synced up, singular, to achieve an end. And I think we're all in agreement on what the end is. The question is how do we go about achieving that? That's helpful to know that APS has gotten a lot of resources on this for the COVID-19 issue to mitigate. We will, with that said, Mr. Blancato, is there anything further that we need to be aware of?
No, sir. We're all good. Thank you very much for the chance to be with you.
Thank you for attending today. We will move on to the next speaker. That is from the District Attorney's Conference, and I believe General Clark is going to do a presentation for us. General Clark, please just state your name, who you're with, and go ahead and move forward. We'll be listening.
Get the opportunity to be here. My name is Dave Clark. I'm from the 7th Judicial District. That's in the eastern part of the state. Oak Ridge and Clinton are notable cities in my district. It's a bit odd being here because I think this is a presentation that any one of my 30 colleagues could give. And of course, General Z has led so substantially on this issue. It seems peculiar telling her about elder abuse. But let me start by saying, from a allied law enforcement perspective, what Director Roush said is something that I think we would endorse as a conference. His observations are what we're seeing as well in the law enforcement field. I think all of us had the sense long ago that this was a burgeoning problem, underreported problem, and a horrible problem plaguing our state. And what we are seeing is that that's true. My sense, at least in the 7th District, is that we're still just scratching the surface. Let's see if I can, thank you. Okay, so to the extent Director Roush and the task force may be interested in some statistics, the DA's conference maintains some ability to count and report on some of these issues, as well as some allied agencies. We saw in 2020 alone over 24,000 reported cases that were reviewed for elder abuse. Financial exploitation in particular between 2015 and 2019 grew by 87%. I think it's important to note that even that startling number is probably muted because of the COVID issue, the lack of awareness among our citizens of the ability to report, the ease of reporting, and so forth. So I would expect, from my perspective, that this trend will continue to grow very quickly as our institutions and citizens learn that there is an ease of reporting, a requirement to report, and that there's a remedy once reporting is done. Financial institution reporting went up about 600% between 2015 and 2019, from 191 to 1,160 cases. Let's see, from more specifically the DA's perspective, we received 50 times more reports in 2019 compared to 2015. Charges that stemmed from financial exploitation went up from 1 to 147 between 2015 and 2021. Again, very likely a muted number because of the things going on in our society. The SEC has reported, as many of you have observed and others have commented, that many of these instances are underreported. And in their report, for every one that was reported, 44 went unreported. What we have found in the field is that victimization, financial exploitation victimization, and other kinds of victimization do not occur in isolation. When we see a report of physical abuse, oftentimes it's accompanied by financial exploitation. When we see a report of financial exploitation, it may oftentimes be accompanied by neglect and other kinds of elder abuse. In many ways, to further build on the child versus adult analogy, oftentimes the schools may report to us a truancy problem or some other issue that they're observing at school. And what we find when we investigate is that there are far broader problems in that home. And so I think whether it's with regard to an instance of neglect or physical abuse or financial exploitation, what we're finding is that once one is reported, once there's an investigation, we're finding that there are a constellation of problems with that particular home or the circumstance of that particular adult. So, some of you may not be familiar, I suspect most of you are, with what's happening with regard to a typical reporting situation. When APS gets a report through the hotline, that generates, of course, a 1215 form, and that 1215 form goes to the DA's office, it goes to law enforcement, and those 1215 forms may generate an investigation all on their own. Of course, there's a screening out process. Some of those cases are not something that APS is authorized to investigate or work on. And my office and other DA offices across the state then try and pick up where APS may leave off and make a determination, sort of triaging those reports and referring them out to law enforcement or to law enforcement and APS. Hopefully, if it is a case where both can be involved, they're pursuing a sort of parallel and joint investigation because those seem to be the most successful models. Obviously, once law enforcement is through with their investigation, then they're referring it back to the prosecutor for prosecution. What's happening in the VAPIT committees across the state is that all of these partners are learning to work together so that none of them are in isolation. As this case or any case is progressing through the system, with VAPIT, APS is communicating to law enforcement. Law enforcement is communicating to APS. The prosecutor is involved trying to guide and assist in that process along the way. And just as we have seen with SIPIT, that model is producing all sorts of wonderful, collaborative, cross-communicative results where the sum is greater than the parts. That's what I believe was intended with VAPIT, and I think that's what we're seeing happen across the state. I was asked to say a word or two about what we're doing in my district. There we go. By happenstance, I attended a meeting of this group a couple of years ago. And unbeknownst to me, a financial institution from my community, a credit union, and another bank in West Tennessee were here to testify. They shared stories of the tellers who were confronted with what they suspected to be exploitive circumstances at their teller window, and how they didn't know what to do. They wanted a solution, they wanted to help, but they were unaware, perhaps intimidated, not sure where help would come. Because of that experience, I partnered with the agency from my community that showed up here. And we decided that based on where things were and the work that this task force was going, that we could see some opportunities to begin doing something in our community right then. And so we have. Much of it along the lines that you all are already talking about, that Director Roush has spoken about, that General Zavignannis just mentioned. We found that with regard to the problem, the partners had to learn to work together. This slide says motivate VAPIT partners. That sounds like perhaps that we alone are seeing the issue, and that's not true. We all have to be motivated as we are learning what one another can do, what our limitations and resources may be, how we can communicate and work together, building teams of individuals that learn to call each other instead of waiting for a monthly meeting. And that's been happening in my district and I'm sure across the state. We found that the financial institutions, as was reported to you during that meeting I referenced, weren't really aware of what they should do. Not that the presidents or chairmen of the board didn't know, but that the tellers might not know. And if they did know, as we heard them testify here, sometimes they might be intimidated, afraid to interfere with that transaction. They needed to know, one, what to do, how easy it was to do it, what techniques could be available under the law to help their customer. They needed to know that there would be support. Some of them, and as they testified here, found that the exploitive individual who happened to be in the bank lobby became angry, even quasi-violent, when they tried to intervene. And so we began a very rapid response system in our district so that individual tellers knew what to do, they knew how to do it, and they knew there would be support available. And we found that offering them and the victim a fast response time made all the difference. So we would try and have a detective respond to that institution while the transaction was underway. The teller would say, just a minute, I need to speak to the manager, and the police are en route. We would intervene in the lobby at the drive-thru at the time. And in that method, we were able to prevent the loss of resources, to do a better job of detecting and ultimately, hopefully, prosecuting that offense. Just in one of my communities in 2020, one of my agencies did a good job of trying to document what was happening. And in that year, again, probably muted because of the newness of everything, we recovered over $1 million that was taken from elder victims. We prevented, we really don't know what we prevented because some things didn't happen, but just those that we were able to stop at that banking level, over $3 million. That's in one community in 1 year. Those are funds that didn't leave Tennessee financial institutions, didn't leave Tennessee communities, and most importantly, lots of money that wasn't gone from and used to victimize our elder citizens. We have embarked on a public service campaign. The DA's conference did this a couple of years ago. All of your DAs have recorded PSAs. We have produced written materials to distribute to banks, to other investment operations, to doctors' offices, and so forth, to raise the awareness of this issue. Because of what happened here, the financial institution that testified for you had sponsored that PSA in my community. And so it's run thousands of times on CNN and Fox News and various networks, raising the community awareness, and we're seeing a tremendous response to people just being aware that there are new solutions available. There's something that they can do, and it's easy to do. And so to the extent we're talking about a 911 system and in General C's case, a rapid response, what we have found on the ground, sort of trying to get ahead on a very small scale, what you're talking about is it's reaping tremendous results for us in Anderson County. So I think you guys are on the right track. Just because we're small, we got a little bit ahead of that in a small way, but it's working for us, and I think there's every reason to believe it will work across the state. So with that, I'll be happy to take any questions you may have.
Thank you, General. We'll proceed with questions. I have one myself. You've talked about the need to educate folks, to raise awareness. You've talked about how you've done some of that, and you've talked about how that has helped to mitigate financial exploitation. I don't know if y'all have any data on that. If you do, I sure would be interested. But secondly, and importantly, my question is this. In addition to raising awareness, are there particular resources that you feel might be needed for prosecution, investigation, and I want to be open with that because I think we have, between TBI, the DAs, the police chiefs are not here today. I know that you all sort of serve similar roles in conjunction with one another, and I would be interested to know if you believe that additional resources that are targeted would be helpful.
Yes, sir. And I'm glad you asked that question. There is a glaring need, frankly. You guys largely probably don't have a glimpse into what's happening in the various investigative divisions of your municipal and county police departments. But the reality is they're all overwhelmed. Whether you're in a community with 5 detectives or one with 50, they all have more work than they can say grace over. They are trained largely to investigate violent crimes, but they may also be chasing stolen weed eaters and lawnmowers. That is their wheelhouse and what they have been trained to do and experienced in doing. And when a lieutenant or assistant chief of police is assigning out work, too often, I'm afraid, we don't have detectives that are trained or skilled in investigating these sorts of matters. And those police departments with those trained resources don't have a detective free to do that work in their mind, because other things may be more violent in nature, may pose a more immediate threat to the community, or it may just be undervalued as a crime. We need detectives or investigators that are trained, experienced, and prepared to dedicate themselves to these types of cases because they take unique skills. In some of my departments, we've motivated and they've been inspired to go do the work, but oftentimes what results is a shoebox full of bank statements and canceled checks. And we don't know what to do with that. They don't know how to quantify it. They don't know how to report it. Oftentimes they don't know how to tease out of these various financial documents, whether it's an investment account document, a power of attorney with legal implications, bank statements, how to say, we've analyzed this, there are $143,292 missing, here are the 72 transactions that you can prosecute. And so we need a cadre across the state of investigators that can do that work. And that's a skill set that typical police detectives often don't have, particularly not in our larger departments. And so if we had investigators that were trained to do that work, I think it would allow us to make tremendous progress.
Thank you, sir. Director Roush, if I might turn to you just for a moment. I know that we do some stuff with Medicaid fraud and things. Do we have any units specifically dealing with financial exploitation? And if so, how robust? And if not, what might be beneficial if we could, in a dream world, give you the tools you needed most?
Yeah, so as you mentioned, our Medicaid fraud division handles, of course, the Medicare system. And so they'll do the robust investigations into any of those violations. They They just recently kind of been expanded, but it still deals just with that Medicaid side of the house, the Medicare system, the TennCare system. And so in terms of this part, it's limited. So this falls on our criminal investigators, not in the MFCD side, not in the Medicaid fraud side. This falls on our criminal investigators. And as was mentioned, they have a little bit of everything going on, right? So we just added 20, but that was just to handle the violent crime that we're handling here in Tennessee, as well as the increase in other types of violent investigations. And so, I would have to go back to the team and really take a look at this and see what a program in this arena would look like, to figure out what an offer, we could come back to the table and say, this is what it would take to cover the 95 counties to address this issue. And I think it's a worthy exercise in that it would give us some idea of what we're addressing. I appreciate the numbers that General Clark gave us. Those will be helpful as we look at this and trying to figure out what a scale would look like on this issue. But I would tell you that we're not resourced to do that at this time. The cases that we do pick up are generally the higher level violations in terms of the higher amounts. And for the most part, local law enforcement is handling this issue as best they can with what they have.
Thank you, Director. Are there any further questions of General Clark or comments from the committee? Senator?
I have a question. I'm kind of reeling in data and information, and I'll try to be succinct in my question. But going back to the report we heard earlier, if you were listening to that, where I think Blumcato mentioned that at least $602 million had been stolen. And the biggest part was grandparent scams, which, and then, so weighing in on that, you had some stats that were just astronomical over a 6-7 year period. Do you attribute that to the fact that you've got more eyes looking at it? I mean, it's hard to believe that, our society's broken. I know that. We all see it every day. But is it because you have more eyes on it, or you're looking more closely? Because it didn't just boom from 1 to 400, overnight. What are your thoughts on that?
Senator, I think that it's been there the whole time,
Right.
as you suspect, as we all suspect.
Right.
It's just that now there are, it's more known how to report. It's more known that you have to report. I think some people are encouraged to hear there's something we can actually do about it. And so hopefully all of those things, I think the legislative efforts and the new laws are having a tremendous impact. But we're not where we need to be or where we will be. I think if we stayed this course, 2 or 3 years from now, we're going to be looking at those number trends continuing as more and more people learn. It's out there. It's rampant. It's still largely underreported, I think.
Just to follow up, if I might, I noticed with General Wyrick and sitting in their APS meetings, the times I've been there, one of their frustrations is really a follow-up to what you said. They don't have the resources to be proactive. All they can do is be reactive. And when you mentioned that, the bank teller can call and someone can respond, well, it's not going to happen in your bigger cities because they just don't have the resources to do it. So the DA's conference gets their ask to the General Assembly together. I just focus on, just the overwhelming stats that you just, those are mind-boggling. And I know in my little community, I've gotten 2 phone calls from the bank about a church member that they thought their children were scamming them. That was when I was Citizen Rose. Because I was involved. So thank you for what you're doing. And I can tell you this, I think the General Assembly some of the General Assembly is going to be doing all they can to help provide those resources. And appreciate Director Rouse and the fact that you commented. We really we don't have the resources to do what needs to be done, but we've got to do more. So thank you.
Thank you, Senator. Are there any further questions or comments from the committee of the witness? All right, very good. Well, thank you, General Clark. This next issue that we're going to talk about, I think, is important. All these issues are important, but to Director Roush's point, and he drew the parallel earlier of vulnerable children and vulnerable adults. And there is sort of this cycle of life, I think, and psychologically, when you become demented, you have Alzheimer's, you need people to take care of you. And when you think about that, what we end up having are people oftentimes housed in facilities that are not licensed, literally residential settings where people are putting beds in there. And some of these folks, I think, are well-intentioned, but what we have found from time to time is oftentimes neglect will ensue, and then so we get calls, and there's been a consortium of folks propped up to try to deal with this issue informally. Thank you to Commissioner Lawrence, because Commerce with the codes, I think they were one of the first folks to deal with this. Director Roush with the TBI, the folks in law enforcement, the DAs, Adult Protective Services, Renee, you guys with Human Services, TN even, Department of Health. There's an assortment of people who are working on this issue, and on a weekly basis, a phone call is had. Caroline Tippins, who's in our office now, who has a decade of experience working in licensed facilities, is now helping to head that up. And one of the things that we deal with is that issue, and what do we do with these folks? As the director advised me, look, James, we could shut every place down, but what will we do with these people? And to his point, we really don't have a place to put them. So we've got to continue to explore this issue. And with that, we'll bring on the next witness, Caroline Tippins, who's Chief of Staff with the Commission on Aging and Disability, who will inform us on unlicensed facilities in Tennessee. Caroline?
Thank you, James. I really appreciate that great introduction. For those of you that in the audience that don't know me, I was formerly with the Department of Health as a Senior Associate General Counsel for roughly 9 years. I'm a healthcare and regulatory attorney. I have a certificate in healthcare compliance. And as James indicated, my background is in advisory and disciplinary actions against health-related practitioners and facilities. Doing all sorts of disciplinary action cases. I joined TCAD after being on several of these elder justice task forces for many years now, as he said, with my nearly decade of experience, and I'm happy to be over there as the Chief of Staff. We are leading a strike force right now on behalf of the Governor's Office about this unlicensed facility issue. For those of you in the audience, the reason that this issue arose is we had an unlicensed facility in the East Tennessee area where there was actually an unlicensed operator and her daughter-in-law that were running 3 unlicensed facilities. At least 10 people were found in a basement with non-working plumbing that were utilizing a bucket. They were being charged the entirety of their Social Security checks. There had been allegations, unfortunately, that Renee's team had to investigate about neglect. There had been some neglect deaths in the home. There were allegations of financial exploitation and abuse. That house, we went through multiple rounds of the various law enforcement agencies, TBI, codes, local law enforcement, the Department of Health, Mental Health and Substance Abuse Service, APS, DIDD, the Fire Marshal's Office, our area agencies on aging and disability doing choices assessments to see if some of these folks had benefits, trying to work together and have these calls to figure out if we could place these folks in licensed facilities, how they could be removed, how could we shut them down. Ultimately, on this particular facility, the Fire Marshal's Office was instrumental because there, of course, with a non-working bathroom and several other things, there were a number of codes violations there that impacted the residents. And so the facility ultimately ended up being shut down for a number of codes pieces, but only after the TBI, Special Agent Carrier, got involved and had to work with the district attorney in that area to get a public nuisance injunction, which I believe is the first of its kind in the state dealing with an unlicensed facility. Traditionally, public nuisance injunctions, I know our DA folks know this, are used for issues, of crime, drug houses, things of that nature. This was the first time where we had a unlicensed facility that rose to such a level that it was ultimately a nuisance to the community. The second home was the same way. They had to work to shut her down for a number of code violations. She had multiple people, I think it was 13 folks in that house, and raw sewage in the front yard. And it took literally a village of all these external stakeholders in the state to come in there and shut these people down. And then we had to work with TN and the Department of Health to find, placement with APS for some of these people. They had to be assessed with the local emergency rooms, which was a strain on hospital resources, and then some of them lacked competency, so they had to be assessed and taken into custody by APS, and emergency placement had to be found with conservatorships. Ultimately, a few of these folks came into the Commission on Aging and Disabilities public guardianship program because, simply put, there was no one else to take care of them. So here we have the problem, is that we have a lot of folks that fall through the cracks here, unfortunately. As we have discussed from many of the unlicensed facility strike force meetings, most of these folks don't have choices. For one reason or another, they have not been able to qualify. They have very few benefits. They're making perhaps less than $750 a month. Sometimes, some of these folks, unfortunately, have been, we had in one instance a registered sex offender. We had another person that was a felony offender. So these would people that would fall through the cracks and not be able to be eligible for a traditional skilled nursing facility or an assisted living facility by virtue of their income level, and also some of them with their crimes. Some of these folks, their families simply didn't have the resources to take care of them. There was quite a bit of false advertising going on here, I think, in some instances, where these facilities were actually holding themselves out as being a good place to put your family member, which was absolutely not the case. As a result of this, we have drafted a 50-page white paper that is on our website that goes through all of this. I'm not going to try to go through all of this. I tried to summarize 50 pages into a very quick 15-minute PowerPoint. So I'm not going to waste your time reading every single bullet point to you. I'm just going to give you a quick overview. But we're happy to put this PowerPoint on our website and to disseminate it to others so that you can read this at your leisure if you'd like. So for what has happened is that this has been very difficult to quantify. I know the Comptroller's office and their team will probably tell you the same thing, that it is very difficult to quantify a lot of these elder abuse and financial exploitation cases because of the way that we report things. In Tennessee, we are a complaint-driven system, and so we have to basically rely on how the complainant reports it. There's various different terms for these unlicensed facilities: group home, board and care home, independent living facility. So it makes it very difficult for the regulatory agencies like the Department of Health, Mental Health and Substance Abuse Service, and others to determine basically how this facility should be licensed. Complicating this further is they keep a mixed population. What we've been seeing here is that we see folks that are developmentally delayed, perhaps, in a facility. We see folks with dementia that have problems with ambulation and a number of other health conditions that are just aged, and by virtue of their age or infirmity, they're very vulnerable to financial exploitation. We also see in this mixed population lots of folks with mental health and substance abuse problems. So essentially, the agencies are struggling to figure out who would license this agency, who has jurisdiction to investigate. The TBI was very helpful here, and then they went through all the 1215s that they had received from January 1 of 2021 through July of 2021. Now, mind you, only a 6-month period, roughly. And they received 64 unlicensed facility complaints. So, as I mentioned earlier, the persons affected, I think this is the number one problem. These are folks that fall through the cracks. They don't exactly qualify for Group 1 of choices, which are your folks that are going to go into your skilled nursing care facilities. And they don't yet qualify for Group 2, that they have the physical disability, and they also have incapacitation or the ability to even receive in-home services. They also don't qualify through Group 3 of choices, which, as you see, require a certain level of care and also SSI. So in other words, these folks fall nowhere, right? They don't have the appropriate benefits. They can't pay for it themselves. They don't have the right amount of funding. So unfortunately, they end up in these unlicensed facilities. Some of these folks have been homeless. Some of these folks, we have found out, have been victims of other crimes, such as financial exploitation. And since they have been financially exploited, they no longer have the resources. So they end up here. As I mentioned earlier, some of the other folks were registered sex offenders and others were actively on parole. Another issue that we have found is the pressure that hospitals face to discharge people quickly. And sometimes, if there are no available beds in a licensed skilled nursing facility or assisted living, they just find placement in these unlicensed facilities. Also, residents with behavioral problems are very difficult to place. Simply put, these residents have no place to go. I think we've talked about the data here pretty much ad nauseum, but what we have found here in particular is studies that have found at least 1 in 10 community dwelling adults experience some form of abuse in the past year. By global estimates, essentially there's 15.7% of the population that may potentially experience abuse. As we all know, there is a silver tsunami that is coming as our baby boomers continue to age. In Tennessee, by 2040, 2,088 million Tennesseans, we'll just go with 2.1, I'll round up, million Tennesseans will be over the age of 60. By 70, 2.6 million residents will be over the age of 60. So right now, we're in an affordable housing crisis because these people are going to have a place to go. So here is basically the licensed facilities. We did a heat map. We went to all the departments and we asked them, what types of facility do you license? Sally's team, they license skilled nursing facilities, assisted care living facilities, and residential homes for the aged. Mental health licenses a number of facilities, group homes, outpatient centers for mental health, community living centers. And so we tried to go through and ask each department which type of facility would be residential. What we found out is, as you see from this heat map, is that there are not as many facilities in some counties that would be residential. And in those counties, as you can see, where there's 3, 7, 1, 4 in some instances, sometimes there's an overlay with unlicensed facilities. Because here is the map of all the unlicensed facilities that we have discovered from just January to July of this year. This is the 64 that have been discovered and plotted out. As you'll note, there's some in Davidson County. There was a plethora of them, unfortunately, in Shelby County, which I'm sure is interesting to Senator Rose. I mean, there's lots of hospitals up there in Shelby County, but there's not as many smaller residential facility types. There's also several in East Tennessee, as we have discovered, including some that are run by one provider operating multiple unlicensed facilities. So what's the deterrent here? Unfortunately, as currently codified, operating an unlicensed facility is only a Class B misdemeanor. And when we talked to the TBI and had them run the data, we could not find that there was any data to show that any unlicensed facility operator had been criminally prosecuted. And unfortunately, as a Class B misdemeanor, that's low-hanging fruit in some instances. And in some instances, there's so many other crimes going on in the facility, to General Clark's point, that, there's a plethora of other things that could be charged. And simply put, they're not going to get charged with that Class B misdemeanor, or it'll settle out. So I think one deterrent here is, if we want this conduct to stop, do we increase criminal penalties? What about the nationwide studies? You heard from Mr. Blancato, there's a lot going on at the national level. But one thing that we have found is this particular issue of unlicensed facilities has not been studied since 2015. What we did find is that the Assistant Secretary for Planning and Evaluation, as the advisor to the Secretary of the United States Department of Health and Human Services, wrote a report entitled Understanding Unlicensed Care Homes, which was published in 2015. Although, and this is notable, there were a few examples of unlicensed care homes who receive good care, it appears that abuse, neglect, and financial exploitation is commonplace in an unlicensed facility. And that's why we're here today. Because unfortunately, the majority of these residents turn over their entire Social Security check or all the benefits that they receive, and these unlicensed facility providers oftentimes become their representative payees. It noted in this study that residents of these homes are extremely vulnerable. Many of the residents Turnover, as I indicated, all of their Social Security check. Conditions in unlicensed care homes are also often abusive, financially exploitive, and neglectful of the residents' basic needs, and situations sometimes can evolve into false imprisonment. Now, this is a national study. It noted that interagency multidisciplinary teams at the state and local level, to General Clark's point, are very important in addressing the various issues involved in such closures of facilities, such as finding housing needs and also prosecuting criminal behaviors of the home care operators. But what it did note is that civil monetary penalties against these unlicensed facility operators are not a good deterrent. You can hit them in their pocketbook, but it's pretty much not going to stop the conduct. Also, some states like Georgia had implemented public awareness campaigns notifying the public of essentially the danger of the unlicensed facilities. Pennsylvania and Georgia were two notable key stakeholders in this area. Common factors found in unlicensed facility homes is that the closure of large mental health institutions made it difficult to transition some of these folks into the residential care setting. So there's a number of folks with mental health and substance abuse disorders that unfortunately fall prey to these unlicensed facilities. Also, as noted previously, the financial pressures that hospitals have to free up hospital beds result in unintentional disclosures or discharges to unlicensed facilities. Here in Tennessee, we find that there are jurisdictional limitations and that there are gaps between each of the regulatory entities' jurisdiction. For example, as we noted, since we are a complaint-driven system, it all turns on what the complainant reports to APS. And so sometimes those things can get screened out. Sometimes they get sent to other agencies. But here's the other issue. Each agency has a different criteria for investigating an unlicensed facility. So for example, APS must have an allegation of vulnerability that meets their criteria, and they could be potentially screened out if there was no allegation of abuse, neglect, or exploitation. So Renee and her team have to have a hook, essentially, to go into the facility. For example, there's also jurisdictional limitations as to the number and types of residents in the facility. So Sally can tell you this firsthand. The Department of Health has a number that they have to meet. Residential homes for the aged have 4 or more unrelated persons. So sometimes if you've got a facility with 2 or 3 unrelated persons, you might not have enough information for Sally and her team to send someone out. Also, the owner-operators have to be doing something like medication administration. So there has to be a service that would be provided to them. And there's different definitions of medication administration for each department as well. Department of Health has a different definition of medication administration than the Department of Mental Health. Mental health has to have 2 or more residents to go out, 2 or more residents with a mental health diagnoses, and there must be also personal care services provided. So, what has happened here? We created this strike force. Mason, you tell me when I'm over time. I've got 4 minutes. I'll be quick. So we have proposed solutions about the strike force that it should continue. Right now it's going forward on Tuesdays and Thursdays. For example, we just got an unlicensed facility in the past week that we've discovered has 11 people in it in Davidson County that are kept in a tall and skinny, and that the provider is operating and indicating that she provides services to elderly and vulnerable adults. She does not hold a license. So, I mean, these are active and ongoing cases that we continue to work. So we're having these meetings, the Department of Health, Mental Health, APS, DIDD, TBI, local law enforcement and our area agencies and disability are continuing to participate. So one solution is potentially codifying that. Another tool would be to use the nuisance abatement because that works so well with Special Agent Carrier, and he handled that so wonderfully with the district attorney up there. And maybe consider adopting nuisance abatement models statewide for these unlicensed facilities. Now, I know that nuisance abatements are difficult to prove, so there will probably need to be some sort of a particular carve-out on that. Also, increased criminal penalties. Unfortunately, as I said before, it's a Class B misdemeanor. One thing that the group has discussed is that for these unlicensed facility providers that operate multiple unlicensed facilities, for example, we had one provider that had, over the past several years, 13 unlicensed facilities, that perhaps that be considered to be a Class D felony. We also think that education is a key component here. Education needs to be provided to the members of the public and also to those who work in the healthcare setting, the hospital setting, the social workers who do discharge planning about what an unlicensed facility is, and that you need to check with the various regulatory entities before you put your loved one in this type of facility. We've also noted that the number 2 call that we get from our INA line at TCAD is, how can I become a licensed provider? How can I care for an elderly person? So clearly, this is an issue that is on some folks' mind. We had a discussion with TenCare, who was very helpful and supportive and participates in all our calls. They've indicated that there may be a mechanism needed for Medicaid diversion, that perhaps there should be considered to be a waiver for folks to stay longer in the community-based setting. They pointed out that the Katie Beckett waiver has worked very well, and so there could perhaps be a model adopted here in Tennessee to keep folks in the home and community-based setting longer. The other thing that was discussed is perhaps reopening Choices Group 3, which is the lowest level of care and service and support offered by TenCare, because that has been proven to show that it saves up to $15,000 per year if the individual remains in a community-based setting. There's also been a discussion that there is emergency placement funds that TenCare provides through APS for individuals who are perhaps discharged from an unlicensed facility or find themselves a victim of abuse, neglect, or exploitation. Unfortunately, that rate is only capped at $245 per day. So that is something else that should be looked at, is could we increase that rate, or should we encourage this model to be adopted in a different way, potentially statewide? Another interesting discussion that we had was tiny homes. I bet you did not know that the State Fire Marshal's Office has approved rules for there to be permanent tiny homes. So you can now build a tiny home on a foundation. So that's another interesting piece, because there are pocket neighborhoods, as Sally was the one to tell me about this, especially developed in Pennsylvania and some other areas, which are villages of tiny homes for seniors. So that's an interesting model. It was also discussed that the village at Glencliff here in Nashville, Davidson County, also has a small village for persons after a hospital stay. So clearly there could be a mechanism that could be adopted there as well. Also, we've spoken to the folks in Oregon, and in Oregon, they indicated that they have these wonderful homes called adult foster homes, and they use the term foster, which are small homes that are community-based settings that allow the person to age in place and reside in the home. Now, their model does allow for some waivers for medication, feeding assistance, and even ventilation, which gets sort of into the skilled nursing set. But it is an interesting thing to think about if we could adopt a model in Tennessee that allowed for community-based setting.
Ms. Tippins, if you don't mind, this has been a very thorough explanation.
Sure.
We are, however, going to have to move on because we have a great deal of information from the Comptroller's office as well and another presenter, and we have pledged to all of you that you will be out of here by noon, and I don't want to keep you too long. So if you could, please wrap up really quickly.
I'm at my very end slide anyway. My whole point was that if we adopt the Oregon model, it would be that we could potentially change residential homes for the aged in the state of Tennessee and make them into a certificate. That way they could be surveyed by the State Fire Marshal's Office, and it would be easier for them to obtain licensure. So that is one option that may also be considered, along with adoption of semi-independent living services that have been offered through the Department of Intellectual and Developmental Disabilities. In conclusion, there are a number of regulatory issues. It will be up to the will of the General Assembly to pick which solution they would like. If you would like to read more, we have a white paper on our website.
Thank you for that, Ms. Tippins. Are there any questions or comments for the witness from the committee?
I just
Director Roush?
Yeah, thank you. I just one comment in it, and that's in reference to the parallel with a foster system. I think
Sure.
that's a great way of addressing this issue. I know from personal experience on handling both levels. Right, I fostered at one point, and then had to deal with a parent at one point on the other side as conservator. So the foster was much more robust, and there were checks and balances in place that were required, not so much on the other side. So I think that's a great idea to move, at least as you look to move forward.
Thank you, Director Rouch. Are there further questions, comments from this task force? Seeing none, we will thank you, Ms. Tippins, for
Thank
that
you.
very thorough explanation. We'll move on to the next presenter. This is from the Comptroller's Office, and these folks have done a very thorough investigation and research study and report not only on problems but also solutions as well, studying the gamut across the state. For those of you who have not seen it, we hope that you'll take a look at it because it is very, very thorough. Are you folks ready to present?
Yes, we are.
Please proceed.
Good morning, everyone. My name is Cassie Stinson, and I am a research analyst in the Office of Research and Education Accountability, or OREA, in the Comptroller's Office. Thank you for inviting us here today to share our findings from one of the reports that we did. So our office goal is to provide the General Assembly and other stakeholders with information to inform public policy. Our reports will come from various sources. Sometimes we'll have requests from the General Assembly. Sometimes we will generate reports internal to our office. This report itself was requested by multiple state legislators. Our report summarizes research about elder financial exploitation and considers Tennessee's approach to identifying, investigating, prosecuting, and convicting perpetrators. It also addresses stakeholders' views about potential gaps that remain in the system, as well as noting areas of progress. The report includes 5 conclusions and 9 policy options. This presentation will focus on our conclusions and will wrap up by outlining some of the policy options. So as we've discussed in other presentations, and as you all know, financial exploitation of the elderly is the wrongful or unauthorized use of assets, funds, or property of elderly individuals. In Tennessee, the agency most closely associated with issues concerning elderly abuse is APS, or the Adult Protective Services. Other agencies, though, and community actors play a role in protecting Tennessee's from elder financial exploitation, and those can include law enforcement, district attorneys, and financial institutions. This slide summarizes several state laws that the General Assembly has enacted since 2016. I'm not going to go through all of them, but in essence, these laws made changes including making financial exploitation of the elderly a standalone offense, authorizing financial institutions to report suspected financial exploitation, requiring district attorneys to create the Vulnerable Adult Protective Investigation Team, and requiring APS to provide copies of investigative files to district attorneys generals. More details about these laws can also be found in our full report, which is available online. Our first conclusion relates to APS, specifically the criteria for investigating reports. We found that those who work with the elderly and vulnerable adults express concerns about the criteria under which APS determines whether to investigate cases of elder financial exploitation, describing it as too narrow. APS criteria for investigating a report of financial exploitation is based in state law, which defines financial exploitation as the improper use by a caretaker of funds that have been paid by a government agency to an adult or to the caretaker for the use and care of the adult. In other words, alleged perpetrators must be a caretaker and the funds in question must be government funds for APS to investigate. The law governing Tennessee's provisions about APS has contained this definition since it was first passed in 1978. This chart here shows that in state fiscal year 2019, out of 3,824 reports of suspected elder financial exploitation received by APS, it screened out 756 reports that did not involve government funds. That represents about 20% of all reports. An additional 1,565 reports, representing about 41% of reports, did not meet APS's criteria for other reasons, such as it was not involving a caregiver or because the alleged victim did not qualify as vulnerable. In total, over 60% of reports did not meet APS's criteria and were not investigated by APS. Several stakeholders, including legislators, have expressed concerns about the provisions that limit APS's ability to investigate. In almost every interview OREA did for this report, APS's criteria was described as too narrow, or stakeholders explained that they wish APS could investigate more of the reports. In 2017, DHS analyzed the impact of expanding the definition of financial exploitation to include non-governmental funds and acknowledged that it was open to the idea. However, expanding that criteria would increase the number of investigations that they would be required to conduct. DHS estimated that 25 new positions, which would include investigators, auditors, and attorneys, would be needed for an estimated cost of $2.2 million. In 2017, the 2017 report also indicated that if other revisions were made to the APS's criteria, additional expenditures would be required. To date, no legislative action has been taken to expand the capacity or scope of APS criteria. Our second conclusion is about the data limitations we encountered. There is no statewide system to track elder financial abuse cases in Tennessee. Without a statewide system, it is not possible to track cases when they are shared between state and local agencies. When asked to provide data about financial exploitation in Tennessee, several local and state agencies provided OREA with numbers about their caseloads. Many of the cases reviewed by OREA were shared between agencies, so the number of unique cases could not be identified. For example, a single case under the investigation by 3 organizations, say APS, TBI, and a district attorney's office. That would be counted as 3 cases in our overall research. Since it is not currently possible to connect a case across multiple organizations, a single case could be counted multiple times. So this chart here shows the information and data that we were able to compile throughout our research. As you can see, the black boxes on the chart indicate a lack of available data. There are also several caveats for the data that we did receive. For example, the Administrative Office of Courts, AOC, can track prosecutions by TCA code. This allows tracking of all cases under the Elderly and Vulnerable Adult Protection Act. Victims' ages are not tracked, though, so the data cannot differentiate between cases which the victim is a younger vulnerable adult and those in which the victim is an elderly person. In addition, prosecutors can choose not to charge exploiters under the Elderly and Vulnerable Adult Protection Act and instead charge them with theft. Without tracking the victim age, cases involving an elderly victim cannot be identified. In addition to case data, we were interested in estimating financial losses to victims and the state. Only one agency was able to consistently estimate the financial loss to victims, and that was the Tennessee Department of Commerce and Insurance. They had decided to track it internally in the form of an Excel file that they were able to provide to us. For agencies with larger caseloads, though, this may not be a possible way of tracking their cases. Many agencies explained that determining the cost of all their cases would require investigators to comb through case notes and files. Due to these data limitations, OREA was unable to estimate the prevalence and cost of elder financial abuse in Tennessee. Our next conclusion is that Tennessee's approach to protect elderly adults from financial exploitation is made up of a patchwork of local and state entities. Their effectiveness in tackling this growing issue, however, is unknown due to the data limitations, as described earlier. Before I discuss why we call this a patchwork approach and why we were unable to assess its effectiveness, I want to first outline the evidence we found that this is a growing issue all the same. APS was able to provide OREA with report and allegation data since 2015, which is shown here on the chart. Sizable increases in elder financial exploitation reports made to APS over the last few years suggest that elder abuse is increasing in Tennessee, or that reporters have become more aware, or a combination of both. From 2015 to 2019, reports of financial exploitation increased by about 87%, as you can see here with the blue line. At the same time, the number of investigations by APS has not increased. This is likely because APS's criteria for financial exploitation, defined by state law, effectively limits the number of assigned investigations, keeping them to an amount that current resources and staffing levels can address. While state law effectively limits APS's investigative scope, financial institutions like banks and credit unions have increased their reporting of suspected financial exploitation. This graph shows the increase in reports to APS from financial institutions from 2015 to 2019. This graph and the one before suggests that elder abuse is indeed a growing issue and that APS is screening out more cases as a result. Although a number of reports from financial institutions has increased, many of those reports are screened out by APS. There are several reasons for this, but one is that those who work at financial institutions are less likely than other types of reporters, such as family members, to know the relationship between the potential victim and the perpetrator. If the report does not state that the potential exploitation was committed by a caregiver, APS is more likely to screen it out. Financial institutions are also more likely to report online or through fax. Reports received via these means often do not provide the same level of detail that a phone conversation can provide, and therefore they are more likely to be screened out than those received over the phone. Although intake workers at APS are expected to follow up by phone on reports submitted online and via fax, they are sometimes unable to reach the original reporter. APS intake workers may also not be able to follow up on each online and faxed report, especially during the summer months when reports of abuse increase and intake workers are at full capacity with phone calls. APS has not increased the number of intake workers since 2015, despite the increase in the reports. If these reports and staffing trends continue, intake workers will have less capacity to follow up on the online and the fax reports. After APS screens out reports that do not meet its criteria for investigation, the agency forwards them to other entities as appropriate. This includes other state agencies, and they may investigate the reports further. Between 2015 and 2019, the number of reports forwarded to other entities increased. For example, district attorneys received 50 times more reports from APS in 2019 than they did in 2015. While the number sent to local police nearly doubled. This has caused these entities, which are located throughout the states, to become increasingly responsible for combating elder financial abuse, leading us to call Tennessee's system a patchwork approach. As explained earlier, it is not possible to track cases where they are shared between state and local agencies, making it difficult to assess whether the current system to protect elderly adults is able to handle this growing problem. OREA requested the number of prosecutions and convictions from each of the 31 judicial districts for cases involving elderly financial exploitation between the years of 2015 to 2019. The ability for judicial districts to track case data is inconsistent across the state, and there is no state system for the districts to input cases. According to case data, in some districts that tracked it, the numbers of prosecution of elder financial exploitation appears to be increasing as districts become more familiar with the new laws. One district attorney general estimated that it would take 5 years from when the new laws became effective to determine their full effect. In 2019, OREA's survey of judicial districts, several cited a need for statewide database that would allow judicial districts to track cases and outcomes. This data, if tracked, could help show legislators and other stakeholders the effects of new laws. The Tennessee District Attorneys General Conference told OREA that it worked with APS during 2017 and 2018 to create a database for elder abuse cases. The database was almost completed, but ultimately not implemented due to funding issues. The estimated cost of the database was about $63,000, according to APS, with the annual estimated cost of $14,000 for technology, staff, and support resources. District attorneys say that financial exploitations cases are particularly complex, challenging, and resource intensive. Many cited a lack of access to staff with expertise in tracking assets and resource intensive. Many cited a lack of access to staff with expertise in tracking assets and forensics accounting, which can hinder investigations of financial wrongdoing. Some districts lack a significant number of criminal investigators, and some must rely heavily on local law enforcement for investigations. Some said that law enforcement officers often lack the proper training to conduct thorough investigations in complex elder financial exploitation cases. In the information submitted to OREA from the 19 of the state's 31 judicial districts, district attorneys indicated that there is a need for additional training for law enforcement, district attorneys, and others concerning the investigation and prosecution of elder financial exploitation and all types of elder abuse cases. One district attorney noted that training district attorneys and law enforcement together is especially beneficial. So for our policy considerations, from our research, we created a list of 6 policy options that the General Assembly may wish to consider. They're summarized here, and there are more details in our full report. These options include expanding APS criteria and creating additional intake staff positions for APS, revising state law concerning the confidentiality of reporters to APS, funding additional APS staff positions for district attorney generals, and funding and mandating improvements to data collection and elderly abuse cases. So those are all outlined in our report, and there are more details on those suggestions as well.
Thank you very much for that report. Are there any questions or comments from the task force? If, Renee, you are representative of APS, and I don't want to put you on the spot. This law has not changed since 1976. The comptroller is looking into this. We hear a lot of times, and it's by virtue of the law. It's not discretionary, obviously. But one of the issues that you all raised that we're all familiar with is if it doesn't involve the caretaker and it's not government funding, we really don't investigate beyond that. Because by law, those are the requirements. If we were to expand beyond that, is APS prepared at this time, and you may not be, to discuss maybe what that might look like if we were to change that? Yes, ma'am, if you don't mind.
Okay, sorry. I think we're certainly open to the conversation. We did a study back in, 2017, but we're going to struggle with some of the same things that the law enforcement and the DAs are. We're social workers. We're not forensic accountants, so we're going to have those type positions. We're also going to have the resources, including your agency, for example. So if we found someone who was being scammed that needed a decision maker, we can't control the money. Our process would be to make a referral over to your public guardian program. And, sometimes those are already, at cap. So I think it seems like it's above just expanding our definition from my point of view. Now, I'm not speaking for my department, but from my point of view, I think we really need to look to see where are the gaps and what is the expectation. I can't recover money under our current statute. So if someone is getting exploited, I can't file a lawsuit to get that money back. But I think there's just a lot of moving pieces there, and we're certainly not opposed to discussing that. I just like to make sure that when we do something, let's make sure that it's effective, if that makes sense, because I do know right now we do have a lot of moving parts in that process.
I will say that the APS has been very helpful to us. We operate a CREVA program, which basically helps to compensate and get people back right when they have been victimized by a crime that is for elderly folks. And one of the things that has been helpful to our AAADs is having access to the 1215s forms that you guys complete on your investigations, and us identifying, I guess, or being able to ascertain whether or not if a crime has in fact been committed. And it sounds like the DAs are taking these 1215s too. I don't know. General Clark had talked a little bit about that. I don't know if he's around here any longer. Someone else may want to speak to it. I don't know if we're reviewing those in their entirety and extracting information from that for purposes of prosecution, that kind of thing. It may be interesting for the audience to know more about that. General Clark, if you'd like to speak to it.
Yes, sir.
General Clark, if you don't mind, if you could come up to the podium here and hit the talk button, we'll make sure that for our folks in the audience, they can hear exactly what you're saying. If you could just state your name, who you're with, and respond to the question, please.
Yes, sir. All of the 1215s are received by each DA in their district from APS. All of those are reviewed. Ideally, they're reviewed immediately and then acted on. We found that to be the best model because time is so critical. Ultimately, they are all the subject of a discussion during the VAPIT meeting. So each 1215 is reviewed as an individual case. But of course, those VAPIT meetings on average are going to be 15 days after the initial 1215 report because the VAPITs are meeting once each month. So we really need quick action within the DA's office and in law enforcement to achieve ideal results. In our case, minutes matter. We want to get to that bank while that person is still in the lobby or in the drive-thru.
Thank you, General Clark. Thank you, Renee with APS. Thank you also with the Comptroller's Office. Are there any further questions or comments from the task force? Director Rouse.
Yeah, just one comment on the policy options slide. On the piece on urging the Medicaid Fraud Control Division to investigate Medicaid outside of institutional settings, that just changed, and so we do have that authority now.
Thank you, Director Rouse. Are there any further questions or comments? Senator?
Just one question or comment. I heard earlier from a couple of presenters that they were having cooperation with the partners involved in all this, but if we expand the law to cover monies that are not governmental, are those partners going to be participating in it? Because we're getting into personal accounts. I don't know who I'm directing that to, but maybe you, Director Dunn.
Hey, well, Senator, we'll open the floor up here for anyone who would like to partake. I think obviously we cross the lines between law enforcement there and also prevention, right? Between those who want to build the case, between those who want to make the arrest, and between those who want to prevent, and to those who are trying to prevent any sort of elder abuse. So most certainly, I suppose if we expanded it, we would get into that. These partnerships are not going away. There's jurisdictional issues that, frankly, I don't think we can dissolve the lines. I mean, the DAs have certain jurisdictional powers that, frankly, are inherently theirs that cannot be crossed over, as does law enforcement. So it may require additional study, but it is, I think, one of the frustrations. Again, it's by virtue of the law, but our system is not as robust as perhaps maybe some other states are in that regard. But that is a bit outside of my wheelhouse. But I'm happy to have further conversations. Yes, ma'am. Renee, please.
Yeah, I could just speak a little bit to that. I do think, I mean, in order for us to be successful, it's going to have to be, because we do administrative investigations. We don't do criminal investigations. So, I mean, I'm not sure, and there's some DAs that could speak to that, but I haven't had a DA take our administrative investigation and be able to prosecute on it. I mean, we don't read the alleged perpetrators, their rights, that kind of thing. So I do think there's going to have to be, if we're talking about, successfully prosecuting and recouping some money, there's going to have to be that collaboration.
Thank you for that, Senator. General Z.
Let me say, it's nice to meet you, Senator Rose. I've heard some wonderful things about you. Was
that Powers or Rose you heard about?
Rose. That was Rose. I got the name right.
Best looking one, I think, maybe.
Let me say from my perspective, I've been fortunate to be involved since 2014 on the first task force. And my eyes were opened with everything that's going on. I didn't know what a 1215 was. So since that time, we've come a long way. One of the things I think that we have developed is this relationship with APS, in where our goal, first and foremost, is to protect that individual. It's not necessarily about prosecuting a case. It's making sure they're safe. That is one of the advantages I do see if we expand that criteria that we will have. It's getting someone in that home, because when we know we got APS that's going to go out there immediately, they're going to help us make sure that that person is safe. So that's one of the things I think expanding the criteria would help us, is to get into that home faster, because that sometimes slows our response time down. And as you've heard on multiple occasions today, response time is everything. Just as it is with saving children, it's the same way with saving elderly people. Whether, if their money's being taken, oftentimes their food is being withheld. So I do think that that would be a benefit to this.
Thank you, General Z. That's a good point. It gets back to what Director Rouse was talking about, and maybe there is a best interest of the child type situation for an adult that might give law enforcement or APS or the proper authority that calls sufficient to go ahead and intervene, and where there's a situation that may be imminent. That's something I think, to look into. Law enforcement is better subject matter expert on that than I would be, but that certainly makes sense, because that's the fear, Senator. We end up in these situations. It's like these folks in these residential settings. They, I think, a lot of times are well-intentioned, some of them not always, though, but when you get these people in this context where they have no other family, they have no resources, they're vulnerable, and they do get preyed on. And frankly, the ones that we're finding out about are only the ones that we're finding out about. There's no telling across 95 counties how much of this kind of exploitation is going on with these vulnerable adults. So we definitely have to do better, Senator, and I appreciate your willingness to help us do so, and I appreciate everybody's willingness here to further engage in this as we go forward. Are there any further questions or comments from the task force here, of the comptroller or otherwise?
Well, thank you all for having us and greatly appreciate your time.
Thank you, ma'am. We now will hear from, briefly, Ms. Elizabeth Baker and Vice President Robert Clements, Vice President, American Resort Development Association. Oh, excuse me, sir.
Good morning, Executive Director Dunn, members of the task force, Senator. We thank you for letting us present today. As you mentioned, my name is Robert Clements, and I, along with my colleague Elizabeth Baker, who is in the audience, are from the American Resort Development Association, ARDA, and we are a Washington, D.C. based trade association. And Elizabeth handles also another entity called ARDA Rock, which is the ARDA Resort Owners Coalition. And we're here to talk to you guys about the timeshare exit schemes. And I think, at first blush, you may say, well, this doesn't seem like an elder abuse issue to me. But I will tell you, because it doesn't fit the classic definition of, physical abuse, emotional abuse, withholding food, or an unlicensed facility where seniors are living in deplorable conditions. But I hope to show you today that the financial harm that is happening to seniors as a result of these schemes in many ways eclipse some of the other schemes that the FTC has highlighted, like the grandparent scheme, the love relation scheme, that sort of thing. We're talking tens of millions of dollars that are being taken from seniors around the country. So it's pretty classic the way the schemes work. The exit companies make cold calls. It's very easy to find out who is a timeshare owner. In many cases, it's in public records throughout the country. You can find that. They're very heavily invested in internet ads, advertised on the radio, television, and I'm certain everyone in this room has heard an ad for, I can get you out of your timeshare. Guarantee it. I go across the country and meet with attorneys general, legislators, regulatory bodies. Everybody's heard the ads. They're spending millions on these ads. The curious thing about this is people assume that the exit companies have some proprietary method to get you out, some way, that this is a legitimate business. And I'm going to suggest to you today that that isn't the case, that they can't accomplish what they're suggesting they can accomplish and taking in millions of upfront dollars from seniors without the cooperation of the developer, the resort developers. So the first step is to, contact the senior through, I think, what we'd all would consider traditional marketing and schemes to get a hold of people. And the real process is, first of all, they almost all suggest there's a 100% success rate, that there's a 100% money-back guarantee. So from a senior's perspective, or quite frankly from a consumer's perspective, what's the risk? They claim to have 100% success. I get my money back if they don't. So the first analysis is there's very little risk on our part, as a consumer to put the money. They all take very large upfront fees for the cancellation process. And I think a very clever aspect of this is they say, hey, it's going to take us 12 months, 24 months, 36 months, even 48 months to accomplish this goal, which has no relation to anything. It's just a very clever way to allow them not to have to deliver the service and hold on to the money. They all basically tell the owners to stop making your mortgage payment, stop making your maintenance fee payment, have no further communication with the developer, with the HOA, with your management company, which in essence, if you're a senior, you say, well, they've said a 100% success rate, they've got a 100% money back guarantee, I guess I'm fine, I'll sit back. But what that does is it keeps the owner in the dark about what's happening. They fail to inform the seniors or the owners that there are programs that the developers have to take back the timeshare interest. Most of them are for free, or there's a nominal charge to transfer it. And really the unspoken goal of this scheme is to have to have the owner default and have a foreclosure and then claim, we got you out and it's a success and we get to keep your money. One of the main things they do, so there is, in my view, I've never seen any sort of proprietary process to get somebody out. I mean, honestly, it's like saying you're a homeowner and I've got some method to get you out of your home where you're not going to be responsible for your mortgage anymore. I mean, it's absurd. On its face, it's absurd. So it is a very clever scheme that I think most people across the country just assume there is some sort of a way that they can accomplish this goal. And I think the reason we're here today is most of these exit companies are targeting seniors. So this slide just tells you there is a lot of activity in this area. There's lots of investigations. There are cases that have been filed. The Better Business Bureau in Missouri did a study that analyzed the complaints that they had or that they'd received, and what they concluded was that the exit companies were using these convincing and high-pressure sales tactics to take money from trusting seniors, making these very over-the-top sort of pitches to the seniors, including a guarantee and the 100% success rate. And most of the complaints were from retirees, often in their 70s or 80s. Many of them were military veterans, widows, widowers. And what this did was put additional financial stress on these elderly folks. And it put most of them in, number one, it didn't get them out of their timeshare because they didn't accomplish the goal. They lost the money because they put a bunch of upfront fees, didn't get a refund. In many cases, they were foreclosed upon, and their credit was damaged. So all around, it was a exploitation in many respects. The next slide is just an example because right now there is no specific regulation that addresses this issue. And the reason we're here today is, number one, to highlight this issue to you guys, but to suggest to you, whereas other problems that have been talked about today, there is a relatively simple solution to this. And I'll get to this as I go along. And we had a law that we were instrumental in passing along with the North Carolina Real Estate Commission that was signed by the governor a couple of weeks ago that I think highlights the solution to address this problem. But this was just one case where a company they were doing business as Resort Relief. They took in Resort Release. They took in $20 million of consumers' money. They didn't get anybody out. And because there's no specific law, the money didn't have to be put in escrow. So ultimately, and this was pre-pandemic, right before the pandemic. They filed bankruptcy. There were more than 20 million in creditor claims, but when they went to the initial creditors meeting, there was less than $100,000 left in the account. And the next slide is simply the observations of the judge in this case, where he briefly said that he concluded, based on the investigation, or based on the materials that were presented to him at the creditors meeting, that he felt that the debtor's business was engaged in substantial fraud and dishonesty, and they've engaged in gross mismanagement with respect to the financial condition, meaning there was only $100,000 left, $20 million gone somewhere. My thing's not changed. There we go. The next slide I put in here, just because this is in your state. There was a company created by a lawyer. He created something called Castle Law, which purportedly was a law firm. And what they did is create a network of affiliates around the country to draw in consumers and seniors. Ultimately, same sort of thing, took in millions of dollars. He shut down that operation. The money's gone. Fortunately, at least your bar association disbarred him. But that didn't help consumers. The money's gone. They didn't get out of their timeshare. Many of the people were foreclosed upon. So the fact that they disbarred him, sure, that helped, but it didn't solve the problem for the consumer. This slide I used in a presentation to some attorneys general months ago. And the reason I put the slide in there was because this particular company called Timeshare Termination Team used the 100% success rate. Well, what I found curious and why I kept the slide in for this one was about maybe a month ago. About a month ago, turns out the company just closed shop and left. Same sort of thing. So this was a news story from Denver. It was based in Denver, but this was a former employee speaking out after the timeshare termination company just vanished with the consumer's money, millions of dollars. And the same thing, because there's no specific regulation, the money wasn't required to be put in escrow or any sort of protection to back up either the claim of 100% success or the claim of 100% money-back guarantee. So I just thought it was curious that a slide that I had picked just to show that there was a 100% success rate claim, these guys end up not only having no success, but actually running away with the consumer's money. The next is just a lawsuit that was filed by the Washington State Attorney General's office. And we went to meet with them before they filed this lawsuit and discussed with them these issues. I thought they did a wonderful job of, it was a 68-page complaint. They did a great job of capturing the issue, and they sued Timeshare Exit Team, which at the time I think was the largest in the country, based out of Seattle. And let me just look at my time here. Yeah, I got 4 minutes. So I just briefly, some of the allegations in the complaint that were that the Timeshare Exit Team, that every step of their exit process was either unfair, deceptive, or just outright false were the claims. And what they pointed out, which is what I have said, is most of these people never received the promised exit. And that the exit caused even more financial harm because they were foreclosed on or their credit was damaged, and they still didn't get out, and they didn't get a refund. So essentially, the Washington State Attorney General alleged this was a grand fraud. And fortunately, 2 weeks ago, the Washington State Attorney General settled with Timeshare Exit Team for $22 million. So, and this is just one company of hundreds of these companies that are out there. So I'm trying to, I put this up there to, number one, try to give you an appreciation for the magnitude of this harm. One company operating all over the country had to pay $22 million, and that only addressed the 5,000 or so consumers that were in Washington State. These guys were operating all over the country. So this is why I suggest to you that this potentially eclipses some of these other schemes that the Federal Trade Commission has highlighted that target elderly folks. And the interesting thing about the first paragraph, you probably can't read it from there, but the first paragraph says that that, let's see here. Well, actually, it didn't capture it, but it talked about the $14,000 that they took from a grandmother as one example of the abuse and exploitation of an elderly person. But the next thing, I put this up there just so you don't think it's me just making something up. Lynx Legal happens to be a exit company based out of, I think it's Charlotte, North Carolina, but they had 100% money-back guarantee. But if you click through to the guarantee, what you see is that if, for any reason, Lynx Legal is unable to cancel, give back, or have your timeshare taken back by the developer in 4 years, then you get this 100% money-back guarantee. So, I mean, you know, the fact that they would, you know, I mean, I think we can all say just it's preposterous that we're going to give these people 4 years. And it's just another clever way to allow them to hold on to consumers' money. I just highlighted this slide because we have worked closely with the Federal Trade Commission on this, and the responsibleexit.com website is a site we created because we constantly get the question, well, what's the industry trying to do about this? Well, we created something called the Responsible Exit website. We've worked with the Federal Trade Commission to get this out. The Responsible Exit website is free. Consumers can go to it. Owners can go to it at no cost. We've spent millions of dollars in AdWord buys and social media efforts to get this word out. What it does is it allows consumers and owners to go to the site, find information out about exit, resale, and sometimes use of your timeshare. It also, you can find your developer either by the name of the developer or the resort name, and then if you click on that, it takes you directly to a team dedicated to exit from your timeshare, and it doesn't cost you anything. So I think I'm got 10 seconds left, so that's pretty good. But so the main takeaway I want you to understand from this is, in our North Carolina law, the solution to this is, I think, very simple. Number one, pass a law or a regulation that requires these guys to put money in escrow, and you cannot have that money until you deliver on the promise. I mean, that's about as basic and simple as you can get. I can almost assure you this business and this, I hate to say industry, but these schemes would go away, because what's happening is they take in millions of dollars, they spend it on sponsors, high-profile sponsors, and advertising to bring more people in. So it's a very simple solution. We'd be happy to share the North Carolina law with you that I think addresses this issue, and I thank you very much for your time today, and happy to answer any questions you may have.
Thank you, sir. Are there any questions or comments from the task force? Seeing none, thank you for your time. Thank you for being here, and thank you for raising awareness on these issues. I have next to me, by the way, Commissioner Carter Lawrence. I think his department oversees some of this stuff and regulates some of this stuff, so I know it's important to him, and I'm sure if legislation is brought forth, he'll be someone that you may want to speak with. With that said, we'll go into announcements here, unless, again, there were no questions or comments of the speaker. We'll go into announcements here. I just want to say so legislatively, the Commission on Aging is tasked with developing a report, providing it to the legislature, so that essentially will be a recap of some of the things offered up today. We will do that. The task force, the response that we have to give is by January 15th, so we'll try to do that relatively soon. I know we elected General Z chair, and we elected Commissioner Gonzalez vice chair. Going beyond January is a matter of whether or not we have another statute. This, again, will sunset at that time, so we'll have to study those issues. I have no further comments or questions, but to say thank you all for everything that you are doing. Again, Director Roush, Commissioner Lawrence, Commissioner Gonzalez, the banking industry, the folks representative of health, our law enforcement people, our DAs do a lot of good work on this. Our local police do a lot of good work on this. I know APS continues to study this in the banking industry as well. So we appreciate everyone being here today, and also our staff, Larisha, for helping to do minutes, Mason, who has helped with our PowerPoint, Charles Ferguson, our general counsel, and Caroline Tippins, our chief of staff, who did that presentation for you all. We appreciate them being here as well. Are there anything that anyone would like to add? Senator?
Just to say thank you to all for what you do. I think we're mandated in God's word to do exactly what we're doing, and I truly appreciate it. I want to say I was late because I had another meeting at 10. I needed to make sure they had a quorum before I was allowed to leave, so I apologize for being late. Thank you.
Senator, we appreciate your presence here, and we can talk, we can pull subject matter experts together, we can explore issues, but at the end of the day, what we cannot do is enact legislation without you. So we appreciate you being here and you signifying to us that this is an important matter. And I know it is to several other members too, including some of those who could not be here today. Senator Briggs, for example, who passed this, is out of town. Otherwise, I'm sure he would be here as well. And I know that there are others working on the issue. I would send a shout out to Chairman Yeager and Doc Kumar, a representative. Both of them serve on our commission and also are helpful on these issues. So thank you for that, Senator. Is there a motion to adjourn? I'm sorry, hold on.
Moved.
Second. There's a race to adjourn here. Okay, motion to adjourn, second. All in favor say aye. Aye. All opposed say nay. We are adjourned. Thank you.